The Bureau of Oral Health has a school screening program that is funded by our partners at DentaQuest and Delta Dental of Kansas.
The screening program was created and implemented in 2008 to help schools fulfill the state mandate to provide oral screenings to their students K through 12 on an annual basis.
We hope to start at a very early age to help address this very widespread problem of chronic dental disease in children.
Oral health is really an issue that isn't seen. You know, our mouths are closed. It's not something that we think about, so it's a great way for us to screen for problems that maybe aren't identified as even being a problem.
I've been involved with the screening program for 3 years here in the Shawnee Mission School District. Well, to me personally, it's just really rewarding that we can offer this service to our kids. Not all of our families have dental coverage, so this is an excellent way for them to see a dentist routinely and to meet their healthcare needs so that they can be in school to learn.
This will be my 10th year. The little kids think I'm the tooth fairy. I would probably compare it to the vision and the hearing test. It's another screening for the child.
We know that dental caries #1 childhood disease, and it also impacts the child's ability to learn.
And we know that a child that is experiencing pain from a toothache is going to have limited ability to do well in school, to pay attention, to do well on tests. Oftentimes a child could have a toothache, could have some pain that is existing, and they are not able to communicate that with the parent or with the teacher. And through an oral health screening, we're able to correctly identify the problem that they might be having.
We are able to get the information to the kids and the parents that don't have any other way of getting the information or the need or the care.
There's many barriers to care, and so the screening program it's that first step so that we can actually get into those schools and do some more.
This screening looks for obvious untreated decay, treated decay, and if the student has sealants on their permanent molars or premolars. Once data is collected on what is going on in the mouth, then treatment categories are assigned, such as no obvious problems, cleaning and/or sealants are suggested, a dentist exam is suggested, where next steps need to be identified, and urgent care is needed, where the parent should get their child into a dentist in the next 24 to 48 hours. This category is marked if the child is in pain, swelling, or infection is present.
A screening is not a substitute for a complete dental exam, and we certainly encourage our students and our school nurses and our parents to still allow their children to see their dentist and their dental hygienist for a complete dental exam.
One of the main reasons why I'm there is for the 2%. Because what I find in all the numbers that I gather, it always seems like there's 2% that have an abscess or they have a really bad infection and they're really hurting. And it's not that they're not being well cared for, they're just used to the pain. They don't know that it's anything different. So, I can screen 300 kids on there for the 2%.
Having a kid, when you ask them, how many times a day do you brush your teeth? And they look at you straight to your eyes and said, I don't own a toothbrush. At that moment, you realize maybe a simple thing that we will take for granted, a toothbrush. One of our kids don't have it. So educating and provide those services to the kids and provide just a simple toothbrush.
The screening program is important because we're able to identify students who may have urgent dental care needs, as well as just to assess the overall oral health of a student or a population of students.
It is also important to see the dental health of the school and community. Getting the snapshot of oral health at each school helps programs know where they are needed most, who is in need of services, and helps us evaluate when services are being provided.
We really utilize it to identify children that are in need and identify schools that are in need of dental care. Then we target those children and those schools to make sure they're getting the access that they need.
Another reason to screen that I feel is as important as all the others is positive exposure of children to the dental professionals. We want to give them an opportunity to see the importance of oral health and overall health, and let the students see us in their settings, letting them become familiar and more comfortable with dental professionals.
This is something you have to make it fun. It's just like the reason they're scared, they don't know what is going to happen. So you just gotta make them feel comfortable and let them know this is something fun.
I really get down to the kids level 1 and make sure that they understand and we have fun with it.
Now I see kids responding to the program positively. I think when we give them a toothbrush, they're excited about taking the toothbrush and getting something cool to bring home.
Every day I brush it in the morning, and then when I finish eating dinner, I go upstairs and brush my teeth. I think a few years ago I had one cavity. I think I had to get it filled, but I think that's about it.
I kind of feel scared, but then when I get over there, it just feels good. I like to brush my teeth.
When we do the screenings, it's just such a quick screening, but we can also see a lot in that 30 seconds that we're looking at a child. For instance, one school I had, I said this child is urgent. They need to see someone right away, and the parent actually worked in the school, and she's like, "What's going on?" I said, "Well, I don't know." So it was just a little abscess right there, but they would have never known.
When people think of dental screening, they are thinking the child needs to get into a dental chair, that there's dental instruments that are used, that we're getting them on their back and we're in the mouth. Really, dental screening is a quick look. It just gives us a quick snapshot into really obvious issues. And it can be just the child sitting in a chair or standing up with the screener just looking in the mouth for 5-10 seconds and moving on.
And most of the nurses I've ran into are all about it. They're so thankful that I'm there to help them, and they're happy to have someone there to do it.
It just takes a few minutes out of the classroom day. I think they can screen a whole class in 10 to 15 minutes. That's 20 to 25 kids. So the oral health program also includes a comprehensive dental care program. So students get their screening, but then they also can get sealants, fluoride varnish, if they need fillings. As long as their parent signs the consent form, they can receive the comprehensive services.
We have parents contact us to get some of the work done in clinic if possible. If not, we will sign them up for our outreach program, and they get seen here in school. So sometimes we see some severe cases and they can get all done and taken care of here in school.
We can get kids seen here at school, and they're done and gone in like 40 minutes, as opposed to a parent taking off a whole half day of work.
You just feel people being very grateful, and it's very heartwarming to be able to do this and see the need and see it being taken care of.
It's just been a wonderful partnership for us.
It seems like the more that we go to a school, the more they remember us, and the more that they have dental on their mind, and they'll tell us a story about how they're brushing better because we came there last year. And so I just really like, being able to hear that. There's still such a big need out there. It doesn't matter what town I'm in or what school I'm in. There is still always a need. There's always need for education.
Even though we were able to screen almost 160,000 students across our state, pre-K through grades 12, we have over 480,000 students that are currently enrolled in public schools across the state, and we certainly see the opportunity for further growth in our school screening program.